I'm always on a quest to find out more medical, chemical, biological, health-related information associated with that miracle molecule out of the medical hemp plant and cannabis plant, CBD. My topic for you today is CBD and neurological disorders. I've written about this in various forms in the past, but what we know so far right now. I've looked into the most articles that were published last month, 30 days ago. So I'm always trying to bring you the best and the latest, greatest information. Neurological disorders are what we're talking about right now. They affect millions of Americans and so many more other people around the world. Their effects can range from mild to moderate to debilitating, eroding independence and quality of life. Disorders like epilepsy, Alzheimer's disease, multiple sclerosis are currently being treated with traditional pharmacological agents, but like anything else, they come with limitations and possible side effects. So, the need to find alternative therapeutic treatments that are safe, that have few to no side effects, or at least serious side effects, and ones that are all natural, plant-based. These have led researchers to the potential benefits of CBD for many health conditions, including what I'm talking about now, neurological disorders. So, neurological disorders. I sometimes say, I wish I could put a neurological disorder in a cup, and it doesn't affect anything else in that person's life. It's in a box. It's contained. But disorders don't operate like that. There are occurring conditions that arise. So the negative consequences of neurological disorders is what I'd like to address now. Instead of going into very specific neurological disorders, that would take hours. Not that I'm opposed to that, but it's important to be aware of the multitude of co-occurring issues and problems that are commonly associated with neurological disorders in general. Most neurological conditions are coupled with the following issues. They come with things like pain, seizures, movement difficulties, mood disturbances, cognitive impairments, disability, diminished activities of daily living, social isolation, depression, anxiety, financial burden associated with the costs of treatment, drugs, care. This is a short list. The human pain and suffering associated with neurological disorders is far more expansive and affect not only the person diagnosed, but neurological disorders affect family members and friends, colleagues, communities, social networks. Nobody wants to see anybody suffer. It's because of these experiences and the burdensome diagnoses themselves that researchers, thankfully around the world, are looking at the therapeutic potential for natural healing and more effective symptom management. And I do stress, as I always should, CBD cures nothing. I don't know of anything that does cure anything, but it can provide more natural healing. It can be beneficial in managing certain symptoms. Now, all good information to know. Let's get a little more complicated. How CBD works within and outside of the endocannabinoid system. This is where I read until my eyes bleed and my brain cells explode, and I don't care. I love it. The body has a natural cannabinoid system, and it is called the endocannabinoid system. Every human being and animal on the planet possesses this. This is one of the central nervous system's pharmacological targets that's involved in CBD's role in neurological disorders. This system contains and consists of CBD1 and CBD2 receptors, as well as anandamide and 2-AG ligands. CBD interacts with these receptors and ligands within the endocannabinoid system, as well as non-cannabinoid receptors, including things like G-coupled receptors, G-protein coupled receptors, transient protein channels, serotonin receptors, and many more. To do what? To achieve numerous health outcomes and better manage systems. There's this chemical tsunami, this super activity that's going on with CBD in the endocannabinoid system, outside of the endocannabinoid system, unlocking the brain's, the guts, and the body's ability to naturally heal us. That's the very layman's way of putting it. But let's look at some research results. CBD has been shown in numerous studies around the globe to help people diagnosed with a variety of neurological conditions. Some studies show that CBD has the ability to help people live with Parkinson's and Alzheimer's disease, and to help symptoms including motor impairment, cognitive decline, and the enemy, neuroinflammation. Neuroinflammation, not inflammation of the joints. Intracellular inflammation. CBD has also been shown to reduce neuropathic pain and anxiety. It has anti-seizure effects on people diagnosed with seizure disorders. Some studies report CBD's ability to reduce brain damage and inflammation in conditions like traumatic brain injury, TBI, and multiple sclerosis. The antioxidant properties of CBD may be effective in prevention of or treatment for various cancer conditions. It may also exert powerful health effects for the following conditions: migraines, post-traumatic stress disorder, schizophrenia, spinal cord injury, Dravet's syndrome, Lennox-Gastaut syndrome, and Sturge-Weber's syndrome. This is another short list, but this would go hours and hours. The amount of conditions which may be better managed with CBD is fairly long, and it keeps growing, and that's the exciting thing about this. And research, I know it, will undoubtedly reveal more results of CBD's ability to help various physical, mental, and neurological and neurodegenerative conditions in the future. All right, I've come to the end. My final thoughts. Some of the worst health conditions that cause human suffering and emotional distress are neurological disorders. They're terrible. Beyond the heavy diagnosis itself, co-occurring conditions do take place, like anxiety, depression, cognitive decline, and dependency. And these all chip away at the person's autonomy, their independence, and their very quality of life. While there are traditional prescription medications and treatments, and thank goodness that there are, and they might help to a degree, and some don't help at all, many come with limited efficiency and possible side effects. They might work for a while and then they lose their effect. With more human, in vitro, and animal studies, I hope that CBD will become a viable, all-natural, plant-based alternative or an add-on. Take our traditional prescription medications, but take CBD with them. That's called an add-on treatment. Let's hope that CBD one day can be a standalone or an add-on treatment for people who are living with neurological disorders. I'm Dr. Jim. Keep coming back, because I will never ever stop researching and providing good meaningful information to you. Thank you. Thank you for watching the video. I appreciate it. And I'd like to introduce you to my book, Living Longer and Stronger with CBD. I had to write this after reading between 500, 550, 600 medical articles written and published all over the world. I had to condense the findings into one easy-to-read book on the health benefits of CBD for physical disorders, for mental, emotional conditions, for neurological and neurodegenerative health problems. I guarantee you, you are going to find this book very helpful for yourself, for friends, colleagues, family members. It's on sale at Amazon.com, but you can check it out at drjimcollins.com. That's drjimcollins.com, or follow the link, okay? So thank you again for your time, and check out Living Longer and Stronger with CBD.